mast cells which line the digestive and eliminative systems. These cells can have as many as 100,000 IgE antibodies attached. When the antibody contacts the antigen, it grabs a hold. When antibodies retain multiple antigens, cross-linking occurs, creating an immune complex. Antigens are seen in figure 5 as well as antibodies in the immune complex. Cross-linking of the antigen on the antibodies triggers degranulation of the mast cell, releasing cell mediators such as histamine, which provokes an inflammatory response. This inflammatory response increases permeability of local tissues in an attempt to wash the invader away and to bring more immune cells to the area. Antibodies cross-link so as to increase the combined size of the particles, making it harder to pass through the gut wall, and so mast cells and phagocytes can recognize them, producing an adequate immune response. Because phagocytes, also known as big eaters, do not recognize particles under a specific size, the formation of immune complexes increases particle size so phagocytes can find and eat them. As shown in figure 6, the phagocyte surrounds and then dissolves immune complex. A phagocyte surrounding and dissolving an immune complex, this is an important function as it prevents food particles from passing through the gut wall into the bloodstream. Antigen overload. Normally, your first line of defense against antigens is the secretory IgA antibodies found in the mucous membranes lining your digestive and respiratory tracts. The IgA antibodies protect their territory much like the Native American Indians did from cowboys. As a number of invading cowboys tried to impose upon the Indians' territories, the Indian adds more warriors. As the number of cowboys invading the Indian village increases, the amount of damage done trying to win the war increases. This exemplifies continuance of the offending foods or drinks. Unfortunately, in this analogy, the cowboys represent food antigens arriving into a leaky gut. While SIgA antibodies are non-inflammatory, their counterparts IgG, IgM, and others soon come to the rescue, and the response they trigger is inflammatory. The immune system's response quickly becomes heated, much like a firefight among battling soldiers. Paradoxically, as described in the book Enzymes, The Foundation of Life by Williams and Mikel Lopez, when the number of immune complexes entering the bloodstream reaches a certain point, the immune antibody system shuts down and a reduction in the activity of macrophages and phagocytes follows. This is one of the reasons people with many kinds of food intolerance and intestinal inflammation suffer from malaise, yet can't describe a specific reaction to offending foods. Immune complexes find their way into joint tissues, organ tissues, nerve tissues, and anywhere else accessible via the microcirculatory system, causing inflammation. Capillary leakage from inflammation results in fluid retention in subcutaneous tissues, causing the appearance of cellulite. The result is activation of the complement system. The complement system is an enzyme system composed of killer enzymes. These enzymes seek and destroy immune complexes embedded in tissues. Unfortunately, they aren't specific to the immune complex. They also attack the tissues they're embedded in. The result is identical to an autoimmune disorder. Prolonged activation of the complement system will produce chronic inflammation, which means chronic pain. Unfortunately, it's common to treat chronic inflammatory pain, as described above, by prescribing anti-inflammatory drugs or cortisone. However, cortisone is an immune suppressant, and anti-inflammatory drugs often produce gastrointestinal inflammation as a side effect. Further inflammation increases leaky gut, which in turn produces additional symptoms. Prolonged inflammation further immobilizes the immune system while the complement system does its destructive handiwork. Painkillers and anti-inflammatory medications so often used allow the patient to ignore the ongoing degradation of tissues. Eventually, cancer, autoimmune disorders, and any number of diseases will present themselves. If a natural, functional alternative is not soon applied, it's simply a matter of time before disease appears. The symptoms are the body's cry for help. Current research on the use of enzyme therapy shows that the correctly prescribed type and dose of enzymes will act to break down immune complexes into smaller clusters. For unknown reasons, when the enzyme reduce the number and size of immune complexes in the blood and tissues, the antibody system is triggered back into action. If the complement system or antibody-mediated systems continue to attack at the expense of surrounding intestinal tissues, the gut becomes progressively worse. As intestinal wall leakage continues, more food antigens, chemicals, food additives, etc. make it into the portal vein and their way to the liver, as you can see in figure 9. Up until about 100 years ago, the liver dealt only with organic substances that is recognized. Today, the liver is overwhelmed in many cases with the sheer number of food particles, synthetic and organic chemicals it must process. Brostoff states that someone who is eating an average diet and drinking unfiltered tap water is likely to ingest and be exposed to at least 200 different synthetic chemicals and chemical cocktails every day. Realize this is not inclusive of the huge number of organic chemicals present in our foods. When the liver cannot process food antigens and immune complexes, some of these particles pass into general circulation. Current food intolerance theories suggest that when the immune system becomes overworked, it will prioritize resources to handle the most threatening issue at hand. In the meantime, antigens and immune complexes pass into areas of microcirculation, particularly around joint tissues, where they settle. Later, often at night, when the immune system becomes more active, antibodies will attack the antigens in the joint tissues. If the number of immune complexes in the blood and tissues rise past the point at which the antibody system gives up, the complement system of killer enzymes may be activated. If the body has become hypersensitized or there are diminished levels of SIGA and nonspecific attack led by IgE, IgG, and IgM antibodies may take place at some point in the continuum of antibody complement system activation. This leaves joint tissues inflamed and painful. In my experience, many patients seeking assistance from orthopedic doctors, therapists, or chiropractors for unresolved chronic musculoskeletal pain are likely expressing the symptoms of food intolerance or chemical sensitivity concomitant with gastrointestinal disorders, food intolerance, and your stubborn paunch belly. As you can see in figure 10, when pain impulses come from the small intestine, bowel, or any organ of digestion, there may be some level of inhibition and possibly pain in the corresponding region of the abdominal wall. It is important to remember food allergies and intolerance commonly causes inflammation in the gut. The greater the level of inflammation in your digestive system, the greater the likelihood that your abdominal muscles will not respond to exercise. Pain or inflammation of the digestive organs will reflex to the abdominals, leaving these important stabilizer muscles weak or disabled. No matter how hard you train your abs in such a state, you will not achieve the flat tummy you most likely desire. Once such digestive issues are addressed, you will look and feel better. Visit any gym and you'll find scores of people who train regularly to shape their bodies only to have distended and often comparatively unattractive torsos. The exerciser or non-exerciser who has not addressed food intolerance is likely to exhibit the dreaded paunch belly and commonly suffer from a host of gastrointestinal or digestive disorders. This is why so many people consume a small fortune in expensive vitamins, sports supplements, and organic foods, yet continue to struggle with their health. Just because you put it in your mouth doesn't mean it actually makes it so far as to benefit your body. Masking messages from your body and the bowel bandits with anti-inflammatory and pain medication is also a great concern. When you use any form of drug that repeatedly elevates cortisol levels, you suppress the immune system, with a resultant decrease in the immunoglobulin secretory IgA, which is the first line of immune defense throughout all the mucus-lined passages of your body. This includes everything from mouth and nose to anus. Suppressing your frontline immune defenses leaves the door wide open for opportunistic organisms to embed themselves in the crypts or folds of your intestinal tract. Here, unfriendly bacteria and parasites have a feast on the food your inflamed gut is unable to digest. You soon begin to accumulate an increasing number of the food allergy and intolerance symptoms listed in this chapter. In the wrong hands, you will also acquire a laundry list of drugs to take every day. I actually had a client taking 16 different prescription drugs at once, and not one single doctor or therapist had ever addressed the basics of health and digestion with her. Taking action against food allergy and intolerance. Blood tests. There are a number of companies that conduct blood testing to determine food allergy and food intolerance. The Czech Institute has had the most reliable clinical results from BioHealth Diagnostics of San Diego, California. While a large number of medical doctors and chiropractors perform food allergy and intolerance testing, you can go directly to an independent testing lab such as Great Smokies. Consulting a healthcare professional does have its benefits, though, as there is a fair amount of patient education and additional dietary management involved. Elimination and rotation diets. The least expensive way to begin clearing yourself of food allergies and intolerances is by going on either an elimination or rotation diet. An elimination diet calls for the exclusion of suspected problem foods for 8 to 12 weeks. Questionable foods should then be reintroduced one at a time. If side effects develop from eating the recently reintroduced foods, you're probably still intolerant to that particular food and should avoid eating it. A rotation diet requires that you don't eat foods from the same genetic family more than once every 4 days. For example, if you eat lamb on Monday, you would not eat it again until Friday. See appendix page 236 for a sample rotation diet plan. Checkpoints on digestion. Now that you have a good understanding of how the bowel bandits make their way into your life and how easily digestion can become disrupted, here are a few tips on how to avoid them and how to improve digestion. Never watch the news while you eat. In fact, never watch anything on TV while you eat, unless you're sure it's going to be funny or make you feel good. Avoid watching sporting events while you eat, especially if you have an emotional attachment to the outcome. The excitement of watching your favorite team will likely cause that fight or flight response, which shuts down digestion, especially if they lose. Don't read technical or stressful material while you eat. Reading the newspaper is just like watching the news and will yield the same effect. In fact, if you ate the newspaper, your digestion would probably be better than if you read it while you ate. If you wish to read something that makes you happy, something inspirational, or something spiritually stimulating. If you have poor eyesight, wear glasses or contacts. It's not a good idea to read at all while you eat because the eye requires a lot of energy to run and can drain energy needed for digestion. Play relaxing music, either classical music or music with a 1-second beat, such as that from the Baroque period of classical music, or New Age music that has no discernible beat. Is relaxing to the body and will stimulate the parasympathetic nervous system. Research from Johns Hopkins University has revealed that rock music causes people to eat faster and to consume larger portions, while classical music, especially slow string music, causes the opposite effect. Drink 2 glasses of clean, chlorine-free water 15 minutes before each meal. Always avoid drinking alcohol before meals. When alcohol of any form enters the digestive system, in the absence of proteins or fats, it irritates the gut and can lead to leaky gut syndrome, setting you up for food intolerance and a host of other problems. Also, avoid drinking coffee or other stimulants before eating. These drinks cause the activation of your sympathetic nervous system, which in turn shuts down digestion. If that isn't bad enough, a release of insulin from the pancreas and liberation of blood sugar from the liver results. Therefore, anything you eat is likely to be shuttled into fat cells, which means you'll probably end up wearing it. Limit use of dehydrated foods and rehydrate nuts, seeds, and dried foods such as fruit, grains, and legumes by soaking them for 12 to 24 hours before eating. It's also a good idea to flash boil dried fruits once rehydrated to minimize your chances of parasite infestation. Dehydrated foods quite often get stuck to the colon wall where they draw moisture out of the colon. In addition to causing pain, this can lead to problems particularly in those with diverticulitis, a disease where the colon develops little balloon-like pockets. These pockets often develop from having to force out bodybuilders, pellet poops, and sinkers and stinkers. My good friend and associate David Webster, author of Achieve Maximum Health, has seen nuts, grains, popcorn, seeds, and just about every form of dried food you can think of come out of the tailpipe while administering a high colonic. Interestingly, many of his clients had not eaten some of what he has seen coming out of their colons for as long as 7 years. Avoid foods to which you're intolerant or allergic to. Chew your foods until liquefied. Eat smaller meals more often. A number of nutritional experts today suggest that the body can only break down a given amount of protein at any one sitting. They feel that eating smaller portions and dining 5 or 6 times a day makes for much better digestion and absorption. Personally, I feel there may be variances among people as to how much protein they can digest, just as there are tremendous differences in the amount of alcohol one can tolerate. Hypoglycemia is also a growing concern. The onset of hypoglycemia is largely due to the overconsumption of simple carbohydrates in drinks and foods, as well as the consumption of drinks laced with caffeine and similar stimulants. Those with poor blood sugar handling capacity almost always find their concentration and overall level of well-being improved when eating more frequent, smaller meals. It's important to remember that all small meals should be correctly proportioned for your primal pattern diet type. Never suppress the urge. You want to have the poopy policeman on the job, but you don't ever want to stop a poopy policeman from reaching his destination. According to Dr. Tom Benteen, you can change the timing of or teach any physiological system in as little as 7 to 21 days. This means that if you suppress the urge to defecate each day for as little as a week to 3 weeks, you can cause a permanent traffic jam in your intestinal tract. This is sure to disrupt digestion, inhibit absorption of nutrients, and increase your chances of toxicity through the bowel. Whenever possible, start your meal with raw live foods. All raw foods, such as fresh ingredients from a salad, contain enzymes that are beneficial to digestion. Pineapple and papaya contain enzymes powerful enough to assist in the digestion of meats and are often very tasty in salads. Case history: Rue T, check. HLC level 2, check. Practitioner level 1, and certified health, Excel, intermediate metabolic typing advisor, client of Paul, check. To most of my friends and those that knew me, I was a fit, energetic person with a successful personal training business. They weren't alone. Adidas thought that my image was so good they asked me to be the face of their brand for 3 years. The truth was that every day was a struggle for me, and it had been that way for a number of years. General lethargy and tiredness upon waking, depression, panic attacks, eczema, rashes, chronic fatigue, abdominal discomfort and bloating, fluid retention, rapid weight gain, strange spacey feelings, excessive thirst, blood sugar level problems, feeling really weak if I didn't eat every 2 hours, and massive appetite, to name but a few of my symptoms, were common ailments which, because of my job, I had become very adept at disguising. My doctor, I felt, might have thought that I was a hypochondriac. My low energy, he suggested, was due probably to my work as a trainer. And since I looked as fit as I did, he also suggested that maybe I should cut down on my training. The truth was, I had stopped training myself altogether. Exercise made me feel worse, and I gained weight the harder I trained. I improved my diet, cut down on fat, and ate fresh vegetables and complex carbohydrates, but these simply made me feel worse. I was sure I was ill and demanded that my doctor take me seriously. I had blood tests, glucose tests, mineral and vitamin tests, and more. All my tests came back as normal. Therefore, how could there be anything wrong with me? In the meantime, I was getting worse. During photo shoots, I would have to hold my distended pot belly in for hours at a time. Anytime I relaxed it, people thought I was playing about sticking it out for fun. It was so uncomfortable. My doctor, who wasn't sure what was wrong with me but was supportive, referred me to a neurological specialist and a top nutritionist for help. Again, no improvement, just worsening of my symptoms. It was difficult for these specialists to take me seriously. On the outside, I looked great to them, and all the tests were negative, so how could there be anything wrong apart from in my head? When I attended a Paul Chek seminar, guess who he decided to pick to demonstrate one of the exercises? Yep, me and my belly. After completing the exercise rather well, I thought, with my belly pulled in nice and tight, he asked the audience, "What do you notice about Ruti?" No reply. "Well, Ruti has an abdominal wall that isn't functioning properly. Look at her lower abdominals. They are not recruiting at all. She definitely has some major digestive issues that need looking into." This was great news. Something was wrong with me. This gave me the confidence to investigate further. I found out about an environmental hospital that recognized the symptoms I presented. After 2 weeks of tests, I was diagnosed as suffering from glandular fever, numerous food intolerances, and chronic fatigue. A strict rotation diet, desensitizing injections, and a truckload of vitamins were prescribed. I followed it religiously, and it got worse. It took me weeks to recover from the test, and I was being told a different thing each time I visited. To make matters worse, I couldn't face taking injections for the rest of my life. It cost me £6,000 to get to this point, and not one practitioner had been able to explain what was causing the symptoms and how they could be treated effectively. All they wanted to do was treat the symptoms and not find out the cause. Time went on, and so did the injections, but I wasn't really feeling any better. I was getting quite panicky about the whole situation, and my stomach, no matter what I ate, was getting bigger and more painful by the day. By this time, I needed a snooze every afternoon just to function. Had really